Talofa, and good afternoon. Chairman Young, Ranking Member Ruiz, I want to thank you both for today's hearing to examine the Department of the Interior and Department of Health and Human Services budget request for fiscal year 2016. I also want to thank Assistant Secretary Esther Nriiana and the rest of the panel, Mr. Washburn, for being here today. I'm excited to be here representing the people of American Samoa and look forward to working with your offices. Mr. Chairman, American Samoa has been affiliated with the United States for more than 100 years now and is of a huge strategic importance to our nation. American Samoa possesses the only U.S. deep sea port south of the equator, capable of handling naval vessels, and remains a strategic foothold in the South Pacific for our nation. With the increase in the interest in the region from China, the role that American Samoa plays in maintaining the United States' sphere of influence cannot be underestimated. We also are a leader when it comes to enlistment in our armed forces. Our veteran population living in American Samoa is approximately 10% of the overall population and suffer from a lack of veteran services on island and other benefits. And the closest place they can go to for medical care and other benefits is Hawaii, 2,500 miles north. Our local hospital is not properly equipped to help our veterans. We are geographically and economically isolated, and our islands don't have the benefit of being inside an economic zone that would generate revenue on par with the states or even the other territories. Yet, for over 25 years now, the American Samoa government operations funding has remained stagnant at $22.75 million per year for an area that does not generate enough local revenue to provide for government operations. As you know, these funds are strictly used for basic Department of Education, local hospital, high court, and American Samoa Community College operations. All one need do is look at the annual funding per student in American Samoa compared to those here in the States to see the great disparity between the two. While these funds are appreciated and essential to the people of American Samoa, there are many other issues facing our islands, including a lack of a Department of Veterans Affairs within the American Samoa government to take care of all of our veterans. Our classrooms continue to deteriorate, and our young people do not have access to academic resources as students in the States. Lack of security for our islands from outside threats. Our one and only local hospital is ill-equipped to handle patients in need of specialized care, and patients often are sent to Hawaii and the mainland for those services, and a lack of reliable transportation between our main island, Tutuila, and our smaller islands of Manua, Ta'u, Ofu, and Olosenga, 60 miles away. Without proper funding, these issues will only multiply in the future, and we must address them now before they become unmanageable. I look forward to hearing how you, Madam Secretary, plan to help our islands. I'm positive that by working together, we can greatly improve the lives of the people of American Samoa. Again, I would like to thank all of the witnesses for being here today and look forward to their testimony. Thank you, Mr. Chairman. I yield back. Dr. Rubido, one of the significant barriers to reducing health disparities for American Indians and Alaska Natives is a lack of quality providers at IHS and tribal facilities. The FY 2016 budget estimates that there are over 1,550 vacancies for providers at IHS. Remote and rural locations, lower pay, lengthy hiring processes, and ill-equipped IHS facilities all affect the ability for providers to be recruited and retained within the IHS system. IHS also has significant issues with turnover rates for their physicians every year. Efforts that the agency has undertaken to improve this clearly have not helped. What is your target timeline between an applicant applying and job placement, and how does this compare to the private sector?
We have been working very hard to reduce the time it takes to hire providers because we know if they get frustrated with the process, we could lose them because it's very competitive out there to hire medical providers. Over the past few years, the Indian Health Service has worked on reducing the time to hire individuals. And for example, prior to the Obama administration, the hiring time was probably over 160, 180 days on average. We've now achieved the goal of the department of getting it under 80 days on average, but it does range for specific facilities, and so we continue to encourage more efforts to improve hiring time because it's so critical. But there's definitely been improvement over time, but there's much more to do.
What efforts are underway at the agency to promote retention of medical professionals?
I've believed from the beginning that for the Indian Health Service, the way to keep the providers is to change and improve the agency and to improve it to be a more efficient and effective business that helps support the providers in what they do. And a lot of our efforts to improve our performance management process, to improve the way we manage our business practices, and to give improvements in customer service, not only to our patients but internally, create an environment where more of our providers will want to stay. We've also reached out to the tribes and asked them to help us with both recruitment and retention, to welcome the medical providers to the community and be a part of the interview process and help them see what's great about their community to live in for the long term. So we've also worked on making more competitive pay so that, you know, if they get other offers from the private sector, they would still be able to stay with us. And our increase in third-party collections does help us be able to increase those salaries as well.
Does IHS include local tribal leaders directly in the recruitment and retention of health professionals? And if so, what has been the response of these leaders?
Well, you know, that's something that the Indian Health Service has been doing over the past couple of years, is encouraging more tribes to actually participate in the interviewing of the applicant and also in giving them a tour of the community when they're there and maybe meeting some of the council members. I have been talking about this over the past few years with tribal leaders, and they've really liked the idea and recognize how important it is to try to welcome these individuals to be a part of their communities. And they've done things like taken them on hunting and fishing trips. They've you know, welcomed them with feasts and so on. So I think it's a very effective strategy that I think will really pay off in the long term.
Thank you. Mr. Chairman?
Yes.